Welcome to the Swedish Cardiac Surgery Clinic. We are honored that you have chosen us to care for you. There are a few important things you need to know. This video will help you get ready for your upcoming surgery. After this video, one of our patient care coordinators will help you select your pre-surgical and surgical appointment dates. Your pre-surgical visit will be a busy day. It can last up to 5 hours and will include multiple appointments, so make sure you have a good breakfast. Our office will coordinate with your insurance and schedule these tests and appointments. We will make sure you know exactly what your surgeon needs to make sure your surgery is as safe as possible. In addition to coming to the clinic, there are some things you can do prior to your pre-surgical appointment to prepare for surgery. If you are having a valve surgery, you need to have a dental clearance form filled out by your dentist and sent to our office as soon as possible. This form is in your new patient packet. You need to have seen your dentist within 6 months of your surgery date and have been cleared of all active infections or abscesses. We also want you to start thinking about discharge planning. Are you planning on going home with help from family? If so, do you have someone who can stay with you around the clock for 7 to 10 days after surgery? Or do you think a transfer to a skilled nursing facility for a week or two to build up your strength prior to going home might be a good idea? Do you live alone? Minimizing the risk of complications for your surgery and recovery is our goal. If you need more intensive rehabilitation after your surgery, we want to know your preferences. You can use the Medicare website for skilled nursing facility rankings. We'll need to keep in touch with you as the surgery approaches. MyChart is a great tool for keeping in touch before, during, and after your surgery. You can send questions or non-urgent concerns directly to us via the internet or the MyChart mobile app and save having to hold on the phone. Good communication is essential to a good surgical experience. Consider signing up during your visit or from home. Ask the clinic staff if you have any questions about this. One more thing. Due to the extreme illness of our patient population, last-minute emergency surgeries are a reality for our clinic, and your surgery date may be changed at any time. We will do our best to avoid this and assist in minimizing the impact this has on you and your family. If this does occur, please be assured we will have your surgery rescheduled with appropriate urgency. We appreciate your understanding. Thank you for choosing Swedish Cardiac Surgery, and we look forward to caring for you.
On the day of your surgery, you will arrive at a time designated specifically for you. You will check in at patient registration at the main entrance of the hospital. You will want to bring the following with you to the hospital: your ID, your insurance card, change of clothes, prescription mouthwash, incentive spirometer, and navigation guide. It is best to leave your cell phone, charger, any entertainment devices, or valuables with family or friends until you are capable of using them after surgery. You will want to leave your jewelry at home. If this is not an option for you, you may bring them with you and have it stored in a patient bag in your room or locked with security until you're ready to use them. If you have any specific questions about what to bring and what not to bring, please ask your pre-surgical nurse in the cardiac surgery clinic. On the day of your surgery, after registration, you will be directed to the unit called same-day surgery to begin prepping for surgery. Once on the unit, you will designate a family member or friend and confirm their contact information. This person will receive updates on how you are doing during the surgery. The designated family or friend will also be given a code to receive updates during your entire hospital stay. During your prep for surgery, you will be dressed in a hospital gown, have more lab work drawn, and possibly another scrub down with the chlorhexidine-based soap. You will also meet with the anesthesiologist assigned to your case to discuss any last-minute questions. While you are preparing for surgery in the same-day surgical unit, you may have one family member or friend with you at the time due to the limited amount of space available at the bedside. You may alternate family members and friends throughout the prep time. It will typically take about 2 hours for prep time before your surgery starts. Once prep is completed and the operating room is ready, you will be taken down for surgery.
After your surgery, you will be transferred to the intensive care unit, or ICU, where the goal is to take out your breathing tube within the first 2 to 4 hours of arriving there. At this point, you will be slowly weaned off of the anesthesia and slowly but surely, your breathing reflex will kick back in. Be aware that you may be cognizant of your surroundings, but still very groggy. Every patient will spend at least one night in the ICU, where your vitals and pain will be closely monitored and medications tailored to your needs. Sometimes it may be necessary that you stay in the ICU for a longer period of time due to blood pressure or heart rate and rhythm issues. Your pain will be frequently assessed using the 0 to 10 pain scale, 0 being no pain and 10 being the worst pain imaginable. Remember, everyone's pain tolerance is different. Some people experience less pain than others after heart surgery. As soon as your breathing tube is out, you'll begin using oral pain medication, typically opioids, on a regular schedule, with IV medication being used as a last resort for breakthrough pain. Today, you will receive an incentive spirometer, or IS, to take home with you. It is a tool to help fill your lungs with air after surgery and prevent illnesses like pneumonia. Between now and surgery, you can practice on it at home. Make sure to bring it back on surgery day because you will use it during your hospital stay and once you're at home. After your night in the ICU, you will be transferred to the telemetry unit, or 4 East. This is where you will spend the majority of your hospital stay. On the telemetry unit, your vitals and heart rate and rhythm will continue to be closely monitored, but less intensively than the ICU. You will receive daily physical and occupational therapy where they will instruct you on how to get in and out of bed and out of chairs with your now healing breastbone, and help you feel comfortable to get up and walking after surgery. The more you participate in therapies like this, the faster you will recover and be able to go home. The nurses on the floor will also be assisting you with a daily shower to keep your incision clean and to lower your risk for infection, as well as administering your daily medications. Once you're medically stable, you will be discharged from the hospital, either home or to a skilled nursing facility. A skilled nursing facility is like a continuation of a hospital stay on a less intense scale. It provides nursing care as well as OT and PT while you recover from surgery. Many factors play into the decision to go to a skilled nursing facility, including meeting health criteria, insurance approval, and a recommendation by your doctors in the hospital. The social worker on the telemetry unit will work with you, your family, and the skilled nursing facility to coordinate a smooth transition if necessary.
Your experience with us will be a reflection of the people who will care for you before, during, and after surgery. It's a big team, and right at the top of the list is your surgeon. They are responsible for your care while you are with us, not just during surgery. Your operation will be performed in its entirety by your surgeon. They are supported in surgery and afterwards by intensive care specialist doctors and physician assistants, also known as PAs. We do not have a fellowship training program. Physician assistants will assist with the actual surgery, as well as managing your orders on a day-to-day basis and updating the surgeon on your progress. There are so many more. Specialists who may or may not interact with you directly, such as data architects and statisticians, as well as pharmacists, phlebotomists, X-ray technicians, and transporters. All apply their expertise to ensure you have a successful surgical experience with us. As you can see, your team makeup is many and varied, but every one of us is critically important to our team, values your safety and recovery, and works tirelessly to put you first.
While you are in the hospital, you will work with physical and occupational therapists who will help guide and instruct you regarding sternal precautions and physical healing. They will help progress your mobility and make you as independent as able. This will all be reviewed by your therapist with you post-operatively. You will review and practice everything you need to know prior to discharging home. This will include getting in and out of bed, getting on and off a chair or toilet, walking, and climbing stairs. Getting in and out of bed after open heart surgery can be challenging. It is important to utilize different strategies to protect your sternum or chest after surgery. You are encouraged to practice these techniques prior to surgery. After cardiac surgery, it is very important to mobilize and be active. This includes sticking to a strict walking program, which will start in the hospital as soon as the day after surgery and continue after discharge. The goal is to walk in the hallways 4 times a day with a hospital staff member. Learning appropriate pacing and breathing techniques will also be important and reviewed during your therapy sessions. This is imperative to the healing and recovery process for your heart, lungs, and body. Because you will be limited in how much you can do following surgery, it is important to set up a plan to have a family member, friend, or caregiver to help you upon discharge home. We encourage you to have this person come in post-operatively for training during a therapy session. After you leave the hospital, you will be expected to walk 4 to 6 times daily for at least 5 minutes per walk. Spread this activity evenly throughout the day. We will also help choose a cardiac rehabilitation location so you can call and schedule your intake appointment. After your surgery, you will need to protect the site of your incision, your sternum, while immobilizing. Though we do want you to pursue active living, you can protect your sternum by following sternal precautions and performing activities in a specific manner. If you are performing what we call load-bearing activities, such as pushing off a chair to stand, pushing up to sitting in bed, or lifting any item, we will have you use a technique where you move as if your upper arms are glued to your rib cage, just as if you're surrounded by an imaginary tube wrapped around your upper body. This method of moving avoids excessive stress to the sternum. However, there are no limitations to reaching with your arms when performing non-load-bearing activities, as long as this is pain-free. Examples of non-load-bearing activities are wiping yourself after using the toilet, washing your hair, or scratching your shoulder. Be sure to listen to your body. If it hurts, don't do it. There is no time requirement for these precautions except let pain be your guide when performing activities. Patients generally feel they can return to most activities in 8 to 12 weeks. In order to restore your health after the surgery, we recommend walking at least 30 minutes every day after surgery. You do not have to walk the 30 minutes all at once. You can break it up to 5-minute segments here and there, but total needs to be at least 30 minutes daily. Ultimately, you will work up to walking the 30 minutes all at once. While you are in the hospital, an occupational therapist will help you learn how to perform self-care activities safely. An example of a self-care activity is getting dressed and using the toilet. Your occupational therapist will review the best methods to perform self-care activities. You will be trained on how to shower safely, care for your incision, and be provided with recommendations for appropriate equipment as needed. It is also important to note, during the recovery period, you are not allowed to drive for approximately 4 weeks after surgery or as long as you are taking narcotics. It is important that you sleep on your back for the first 4 to 6 weeks after surgery to allow your sternum to heal properly. Note that stairs are not off limits. In fact, we love stairs. It means you are up, walking, and moving, all of which help your recovery after surgery. Just be sure to allow plenty of time to get up and down the stairs, and don't be surprised if you have to take a break halfway up the flight. You will be deconditioned after the surgery, so be patient with your body while it takes time to heal. Cardiac rehabilitation usually starts 4 to 6 weeks after surgery. The cardiac rehab program includes medically supervised on-site exercise sessions that are individualized and designated to gradually increase each participant's strength, endurance, and confidence. Cardiac rehabilitation also includes risk factor reduction education that help participants understand more about their heart disease and the benefits of healthy lifestyle changes. The program's goal is to help each participant successfully recover from surgery and then get back to doing what they enjoy, whether that is downhill skiing, swimming, or walking.
Now that surgery is over, you'll be ready to leave the hospital either to go home or to a rehabilitation facility. You'll take everything you've learned up to now home with you, and we hope it will help you have a smooth, comfortable recovery. One of the medical staff of the Swedish Cardiac Surgery Clinic will contact you or your family within 1 to 2 business days after your discharge. We will check to make sure your recovery is going well, answer any questions you may have related to what to worry about, and discuss symptoms you might be experiencing since your discharge. If any of your symptoms indicate the need for follow-up, we'll arrange that as well. During our call, we'll schedule your post-operative appointments with our clinic and make sure you know what other follow-up appointments have been recommended for you. We will coordinate your referral for cardiac rehabilitation and, if needed, anticoagulation management for warfarin dosing. One of the most important aspects of your home recovery is consistent care. It is crucial that you follow your daily checklist, which reminds you to check your incisions for signs of infection. Take daily showers and weight measurements, and be diligent in doing your breathing and walking exercises. Spreading your walking and breathing exercises throughout the day help to reduce the risk of post-operative complications such as pneumonia or clots in your legs. In addition, following your sternal precautions should reduce the risk of sternal injury. Make sure you weigh yourself in the morning before you eat breakfast and call us if it increases or decreases by 4 pounds in any 2-day period. The way your body manages its weight is a very good indicator of how your body and heart are recovering after surgery. If you notice worsening swelling in your legs or worsening shortness of breath with exertion, don't hesitate to contact our office. Feel free to use MyChart to contact us as well. As long as it isn't an emergency, for emergencies call 911. If you haven't signed up yet, for nurse or nursing assistant can help you do that before you leave. Your incisions should all be open to air, which means no dressing in place except the one on your neck. That one can come off after 24 hours. You should have black stitches at each of the chest tube sites. Those will remain until your follow-up appointment with Swedish Cardiac Surgery about 3 weeks after your discharge. You should take daily showers and use your surgical soap and around your incisions until they are fully healed. This can take 2 to 3 weeks or more. If you're concerned about your incision, call us. We may be able to evaluate it with photos you take at home and send to us at the clinic. You've been working with physical and occupational therapy as well as your nursing staff to learn how to move safely after your surgery. Once you get home, you'll need to take those strategies and adapt them to your own surroundings. During the first 7 to 10 days after you leave the hospital, we ask that you have someone available to you around the clock. This allows you to get the help you need when you need it. Nutrition after surgery is another important part of a successful recovery. Your body needs more energy than normal to heal itself, which means you need to focus on high-quality, nutrient-rich foods. Your appetite may be reduced, your sense of taste diminished, or you may be experiencing nausea, vomiting, or constipation. Even if you don't have much of an appetite, eat if you can. If you have any questions, once again, feel free to check in with us, especially if you have nausea or vomiting. If you are being discharged with warfarin, an anticoagulant, which requires frequent monitoring, make note of the first day you need to have your blood drawn. You should receive a lab order form on discharge, and the date will be listed in your instructions. The Swedish Cardiac Surgery Clinic will coordinate this referral. Sometimes while you're getting accepted and admitted to a new clinic for anticoagulation management, Swedish Anticoagulation Clinic will manage your warfarin dosing over the phone. Make sure you get your blood test for anticoagulation management drawn before 10 a.m. and make sure the lab or doctor's office you go to for your blood draw has the ability to process it stat. Usually, it is better to go to a hospital outpatient lab than a doctor's office for this kind of test. Like everything related to having this surgery, it may seem complicated and overwhelming thinking about managing this at home. We trust you do your best, and remember that Swedish Cardiac Surgery Clinic is here to help. Thank you for trusting us with your care.